A very novel trial called the MI-Free study presented its main results today. Can you tell us a little bit about this?
MI-Free was a randomized, clustered, randomized controlled trial. It was really a policy trial randomizing patients in the Aetna insurance group to either free medical care with regards to pharmaceutical coverage or their regular co-payments. It's really a novel policy study. I have never heard of one of the similar sort. They would randomize people based on where they got their coverage, from a Fortune 500 company down to the mom and pop shop, down to people who had individual healthcare coverage, to see whether free medical care would improve both medical adherence to drugs as well as repeat cardiovascular outcomes after having a heart attack. Very novel idea and hypothesis.
What were the main findings in this trial?
So to place it in proper context, the most provocative finding, I think, is that the rate of adherence to medications when you're provided with free drugs was only a few percentage points higher than those patients who had to remain and pay on their co-payments still. Despite that, the primary endpoint of major cardiovascular events or revascularization just missed statistical significance with a risk reduction of about 11% in those patients provided free drug care versus those who remained on co-payments. Their secondary endpoints, which were more hard endpoints, were statistically lower in those patients with free drug care. Also very interesting, patients who were provided free medical care with regards to the drug coverage had less co-payments overall and less payments for themselves. The insurance company had less payments as well in terms of their coverage for either medical care or the pharmaceutical coverage.
What do you think are the major implications then for clinical practice?
Well, again, to consider this in the proper context, these were already medications that had been rigorously proven to protect patients and lower recurrent events. So it wasn't that the drugs were being tested, it was the concept, the policy that providing free pharmaceutical care would improve outcomes. So despite not actually hitting their main outcome because of the low adherence rate, I think it's very provocative to ask our national healthcare decision makers as well as the private care coverage from health insurance, when we talk about healthcare reform, you really have to seriously consider this policy initiative and consider it that it may actually be one of the cost-saving mechanisms that we should be considering employing.
It's very interesting. We talk a lot about comparing drug A to drug B, but then even when the drugs are given free, patients often don't take these medications, do they?
That's the other jack in the box, and really the question is why people are not adhering. It has to go way beyond just providing free medical care, and so we really have to dig deeper as to understanding the reasons why. I think this trial will be really paying off in the long run with a lot of insightful information with regards to that too.